Dr. Amish Adalia is a senior scholar specialising in infectious diseases with the Johns Hopkins Centre for Health Security. He joins us now via Skype from Pittsburgh. Good to have you with us. Doctor, why is this outbreak in the DRC proving so difficult to contain?
One of the things we know about Ebola outbreaks is that there are simple methods that can usually stop them, but it only works when the community is engaged and they're actually receptive to that idea. And we saw this in the West African outbreak in 2014, is that if the community isn't going to be receptive to these public health interventions, you can really have an outbreak spiral out of control. And that's what we've seen in the DRC. And coupled to that, we have armed violence there as well, which has made it probably the most challenging Ebola outbreak in history.
If this outbreak is allowed to continue for, I don't know, months, years even, what impact upon the people of the DRC could it have?
Well, what the real fear would be is Ebola would become what's called endemic in that area, meaning it becomes a normal infectious disease that they deal with on a day-to-day basis. And that would be a disaster if we let that happen to the DRC. Ebola has never done that any other place. We've been able to stamp out these outbreaks, but it would be devastating in terms of the economy, in terms of the isolation that would happen to that country, and the stigma that would happen. We've already seen a border slowdown in Rwanda. We've already seen Saudi Arabia failing to issue visitors visas to people going to the Hajj from the DRC. That would only get worse if this isn't controlled. We
heard a man expressing frustration that he hadn't yet been offered the vaccine in our report a few moments ago, that there is a vaccine. I was reading today that there is another one as well, which is as yet untested, but the signs are that it is as effective as the vaccine that is currently in use. Why isn't there a widespread vaccination program against Ebola?
Well, right now you have to remember that this Ebola vaccine is experimental and we don't have a whole lot of it. There are stockpiles of it, and we're using what's called a ring vaccination strategy when we can, which means vaccinating the contacts of people that have Ebola, trying to really use this vaccine in the most strategic manner to stop the outbreak. But it actually hasn't worked. So there are some calls to really start vaccinating in a more blanket fashion if we can. And the fact that we've got a second vaccine now going into clinical trials is all good news. These are tools we didn't have even 5 years ago against Ebola. So that makes us a little bit more optimistic, but we have to use this vaccine in the most effective manner. And we also have to do the normal public health activities of finding cases and isolating them and getting people to treatment units to stop this outbreak.
So what is the magic bullet here, if there is one? Is it the vaccine? Is it the public health initiative? Is it getting the people on board so that they are aware and they learn to trust the healthcare specialists who are there to try to prevent the spread of the disease?
There isn't one single magic bullet, but if there was one thing that's lacking in this outbreak, it is community engagement and receptiveness of the population to healthcare workers there that are trying to save their lives and stop this outbreak. And what we've seen is unprecedented violence, hospitals being bombed, doctors being killed. That's not going to do anything but allow this virus to continue to spread. So there has to be some control of this violence there and some receptivity by the population to any kind of intervention for it to work.
Doctor, really good to talk to you. Many thanks indeed for being with us. Amish Adalia there.
Thank you.